Welcome back to Talkpoint. Tonight's top story: a massive cyberattack on a major US healthcare provider has exposed the personal data of more than 10 million patients nationwide. The Department of Justice has launched a full-scale investigation into the branch, which has raised urgent questions about cybersecurity vulnerabilities in America's healthcare system. From stolen social security numbers to leaked medical histories, the scale of this branch is staggering, and more millions of Americans, the fallout could last a lifetime. Hospital computer screen hacker still halted 10 million patients affected text overlay. The branch was first detected last week when unusual network activity was reported at HealthSecure, one of the nation's largest healthcare providers with facilities in over a dozen states. Cybersecurity experts say hackers gained access to internal systems through a phishing email sent to multiple employees. A single click was enough to compromise login credentials. Once inside, attackers moved laterally through the network, accessing database contacting names, addresses, social security numbers, insurance details, and even sensitive medical records. Patients in hospitals, waiting rooms, medical files, data servers. Then the 10 million patients affected span multiple states from California to New York. The stolen data is believed to have been posted for sale on the dark web within days of the breach. Experts warn that medical data is even more vulnerable to criminals than credit cards numbers because it can be used for identity theft, insurance fraud, and targeted scams for years. Cybersecurity analysts say that a credit card can be cancelled. A medical history, that's payment permanent, and once it's out there, you can't take it back. DOJ building, FBI agents at computer desk, press conference footage. The Department of Justice, along with the FBI Cyber Division, is now leading the investigation. Officials are also working with the Department of Health and Human Services to determine whether HealthSecure complied with federal privacy laws under HIPAA, the Health Insurance Portability and Accountability Act. If negligence is found, the company could face millions in fines and lawsuits from affected patients. Interview with concerts patients' family at kitchen table reviewing bills. For the millions whose data was stolen, the consequences go far beyond convenience. Victims may face fraudulent medical claims made in their name. Incorrect Medicare information could be inserted into their records, potentially leading to dangerous treatment errors. Stolen identity data can be used to open credit cards, take out loans, or file false tax returns. HealthSecure has announced it will provide 2 years of free credit monitoring and identity theft protection, but for many victims, the risk could last far longer. Charts showing rise in healthcare cyber attacks over past 5 years. Cyber attacks on healthcare providers have skyrocketed in recent years. In 2024 alone, more than 700 healthcare branches were reported, affecting over 130 million Americans. Why so many? Hospitals often run on outdated software, and patients' data is spread across multiple networks that don't always follow the same security standards. Combine that with the urgency of patients' care, and hospitals are often more likely to pay ransom quickly just to restore operations. Cybersecurity training session, IT teams upgrading system. Cybersecurity experts say this latest breach should be a wake-up call for the entire industry. Recommendations include 1. Mandatory cybersecurity training for all healthcare staff. 2. Multi-factor authentication for all system login. 3. Regular penetration testing to find vulnerabilities before hackers do. 4. Faster branch detection system to stop attacks in progress. IT security experts say that hospitals need to treat cybersecurity the same way they treat patient safety because in today's world the two are connected. If you think your data may have been compromised in this breach, here's what you should do immediately. Monitor your credit reports for suspicious activity, request a fraud alert or a credit freeze from major credit bureaus, review your medical records for treatments you did not receive, be wary of phishing calls or emails pretending to be from your healthcare provider. DOJ press conference, healthcare facilities, computer codes. The DOJ says it could take months to complete the investigation, but early indications suggest this was the work of an international hacking group. Meanwhile, Congress is expected to hold hearings on healthcare cybersecurity later this year, with lawmakers from both parties calling for tougher regulations and higher penalties for companies that fail to protect patients' data. Dark web imagery, patient shield hunters, DOJ billing. This latest breach is a stark reminder that in the digital age, our most personal information is only as safe as the system that restores it. We will keep following this investigation and bring you the latest as it unfolds. This is Talkpoint. Thanks for watching. Stay alert and stay informed and protect your data.